Welcome to Luca and Miguel. Enjoy the video.
You're starting now. Wash and fully dry the scalp to remove oils, then sanitize your roller with 70% alcohol for at least 5 seconds. Use a 0, 25 to 0. 5mm Derma roller only on a clean scalp. Roll gently in 4 directions with light pressure, about 10 passes each way. Once done, wait 2 to 5 minutes and apply 1 ml Minoxidil foam or the prescribed dropper amount directly to treated zones. This timing helps absorption without excess irritation. Now focus on steady technique and timing. Limit derma rolling to 1 to 2 sessions per week at 0. 5mm or weekly if you're new to allow healing. Make controlled passes, no aggressive puncturing, and stop if you see blood. Immediately after rolling, apply Minoxidil so it reaches microchannels, then pause. Let it absorb for 20 to 30 minutes before touching hair or using styling products. Also, avoid combining other strong topicals like retinoids or acids for 24 to 48 hours to reduce irritation. Finish by thoroughly rinsing the roller, sanitizing with alcohol, and letting it air dry in its case to prevent contamination. You'll usually see mild redness that resolves in a day. If you develop severe pain, pus, fever, or swelling that worsens, stop treatment and seek medical advice. These are signs of infection or adverse reaction. If persistent irritation appears from Minoxidil, pause the product for a few days, switch to lower concentration, or consult your provider for alternatives.
Thanks for watching and please subscribe. It's the best investment you'll ever make.